and came back, and let's assume, based on Dr. Murray's words, that when he came back, having only been gone for 2 minutes, he promptly called 911. Would Michael Jackson be alive today, in your opinion? Or would he have a better chance of being alive today?
I believe he would be alive, but with neurological injury.
And why would he have neurological injury?
He still would have a period, his brain would still have had a period without oxygen of 8 minutes or so, something like this, given what I understand about the arrival times. And that period without oxygen would be enough to cause brain injury. So I believe he would have survived, but with a bad neurological outcome.
And again, because of the setting and not having the equipment there would be the supplemental delay of the paramedics actually arriving on scene with the necessary equipment.
Yes.
In the same scenario, and let's assume again that Michael Jackson's laying there alive, Conrad Murray leaves for just 2 minutes, as he told the police, and comes back, notices Michael's condition, but has the ability to ventilate and has the ability to treat the patient as a competent doctor would Michael Jackson still be alive?
Michael Jackson would be alive and uninjured.
I want to talk about the chest compressions. You've reviewed Dr. Murray's statement to the police in which he described doing one-handed compressions on the bed.
Yes.
Okay. Now, how effective, in your opinion, is a one-handed compression to a patient on a bed?
Not at all effective.
And why is that?
The problem with performing CPR, chest compressions, on a bed is that when you push on the chest, the patient just sinks into the cushion. You have to actually compress the thorax. You have to actually move the sternum against the spine and the back to squeeze the heart and also to move the blood in and out of the thorax, which is part of cardiopulmonary resuscitation. Just pushing the patient in and out of the bed is not effective. To push correctly, you have to be positioned. The force has to come directly down. If you're trying this with your hand, not only do you have a very poor mechanical advantage, but it's very hard to push straight down with a one-handed compression. It's always two hands pushing straight down with the patient on a firm surface. So you're not just pushing the patient in and out of the bed, which does nothing useful.
Now, what if Dr. Murray had a single hand under Michael's back and then was compressing with a single hand?
You just can't muster the force that way. You need your body weight behind this. You can't squeeze this. There's no power in that kind of positioning to squeeze something. You need your body. I've, in the course of years of training, done a lot of CPR and been involved in a lot of resuscitation, particularly as what's called a house officer in the early days of my training. And you throw your body into it because that's what it takes to move the breastbone, the sternum, enough to effectively pump blood for the patient.
What should Conrad Murray have done in that situation?
After calling for help.
911.
After calling 911. You would move the patient to the floor so that you're doing the CPR, the chest compressions, on the floor, and that way the force is effective, and that way you can also position yourself. Essentially, you straddle the patient with your legs, or you could be on the side, either way. But the point is, your arms are straight, you're moving your whole upper body to do CPR next to the patient on the floor. That's effective cardiopulmonary resuscitation. That's effective chest compressions, is what I should have said.
Now, you noted in your report that this was a serious violation, and you note that Michael Jackson's problem was that he wasn't getting oxygen. Can you explain that, please?
Yes. The issue here is not that Michael Jackson's heart has stopped. It's that the oxygen has run out of his lungs. He has stopped breathing. And because he has stopped breathing, his lungs have run out of oxygen. And his heart is only stopping because the heart has been starved of oxygen. What needs to happen, particularly when there was a pulse, as described, what needs to happen is you need to get oxygen into the lungs. That's why Michael Jackson is dying. He's running out of oxygen. And the resuscitation has to focus on getting oxygen into the lungs. In the presence of a pulse, the heart doesn't need to be compressed. The heart's beating. It doesn't need compression. What you need to do is you have to get oxygen into the lungs. If you get oxygen into the lungs, the heart will not die. But that needed to be the focus, not chest compressions.
And you're basing that on Conrad Murray's own words that when he returned after 2 minutes, he felt a thready pulse?
Correct.
Now, you also noted that the mouth-to-mouth resuscitation, as described by Conrad Murray, was also a separate and distinct serious violation. Can you describe that, please?
Yes. Mouth-to-mouth resuscitation for a member of the lay public who finds a person on the ground unresponsive is all you have available to move air in and out of the lungs. In that setting, there's no alternative. But for a healthcare provider to resort to mouth-to-mouth resuscitation is an admission of failure to have proper resuscitation equipment available. I've only done mouth-to-mouth resuscitation once in my life, and that was in a hospital when I was the first responder to a patient who had arrested, and I did mouth-to-mouth for about 60 seconds until the rest of the team arrived with the proper mask and bag. Because for a healthcare provider, mouth-to-mouth resuscitation is a demonstration, an admission that you don't have the equipment you need to properly move oxygen in and out of the patient's lungs.
And for a doctor then, because you differentiated between a layperson and a doctor, for a doctor in this situation that took place in this case, then the bag mask ventilation would be the standard of care?
Yes.
And because that's essentially more efficient at moving air into the patient?
That is absolutely correct. It's much more efficient. When you breathe into a patient's lungs, that's your expired air. The oxygen level in room air is 21%. I believe that the oxygen level coming out of your own breath is just 18%. You've lost a lot of the oxygen already that you're putting into the person's lungs. They need more oxygen. They don't need 18% oxygen that you have expired.
And that was a serious violation?
Yes.
Now, assuming what Conrad Murray said is true, that he was gone for 2 minutes and came back and felt a thready pulse, those are his words, could proper care at that time have saved Michael Jackson's life in that scenario?
Absolutely.
And again, that goes to the need to ventilate the lungs.
With oxygen.
Now, do you recall in Conrad Murray's statement where he describes raising Mr. Jackson's legs?
Yes.
And I believe you characterized that as a minor violation?
Yes, it was just a waste of time. I don't know why he did it.
And that's what I want to ask you about, because you did note it in your report. Why do you characterize that as a waste of time that Conrad Murray raised Michael's legs?
You would raise a person's legs if you believed that they needed more blood going to the heart. So if a person has had some sort of traumatic injury or a gunshot wound or something like this, it's certainly a very reasonable thing to do. But that's not the case here. There's not a problem with too little blood in Michael Jackson. So you would raise the legs to transfuse more blood to the heart. That's not the problem. The problem is he needs oxygen in his lungs. And even thinking about raising the legs, to me, just suggested that Dr. Murray was quite clueless as to what to do. It doesn't make any sense. It's not treating anything that needs to be treated in this setting.
For what is flumazenil used?
Flumazenil is a drug that can reverse or antagonize the effects of any of the Valium type of drugs. That would include lorazepam, that would include midazolam. And intravenous flumazenil is essentially an antidote that can quickly reverse an overdose of those drugs.
And in this scenario where Conrad Murray admits to giving, over the course of time, in his words, 4 milligrams of flumazenil, was it 4 milligrams of lorazepam, was it appropriate then to give him flumazenil, and did you draw any conclusions from that?
There was nothing wrong with giving flumazenil. It might have been useful, but 4 milligrams of lorazepam given hours before would probably not require reversal. So I thought it curious, given the description of only giving 2 doses of lorazepam, each quite small, that he would choose at this critical moment in Michael Jackson's life to give a drug to reverse lorazepam. It doesn't fit.
Does it indicate to you in your review of the records that Conrad Murray was aware he'd in fact given more than 4 milligrams of lorazepam?
That was my interpretation. That he knew he'd given a lot of lorazepam, which is why he very quickly reached for the antidote to lorazepam. He knew that Michael Jackson had had a lot. That was my conclusion.
Dr. Shafer, you speak about then the failure of Conrad Murray and the deception of Conrad Murray in that he did not reveal to the paramedics that he had administered propofol, and additionally he did not reveal to the UCLA emergency room team that he had administered propofol. Did you find that to be a deviation from the standard of care, and if so, how would you describe it?
That is a egregious deviation from the standard of care. When a person's life hangs in the balance, as it did, to withhold information is inexcusable. And he withheld the information about the propofol. He also mischaracterized this as a witnessed arrest, which is very different from what it was. A witnessed arrest is usually not an arrest for lack of breathing. A witnessed arrest is usually something like a heart attack. You see the person and suddenly they're down and something catastrophic has happened. Particularly when a physician has witnessed an arrest. You assume it's some sort of cardiac